Hello, and welcome to this lecture discussing the disorders associated with the central nervous system. My name is Laura McLeod, and I am an instructor here at Ultimate Medical Academy. In this lecture, we will be going over the disorders specifically in relation to the central nervous system. Let's get started. Here's a list of disorders that is associated with the central nervous system. Meningitis is the inflammation of the linings of the brain and spinal cord. The cause may be bacterial or viral. Encephalitis is an inflammation of the brain. The disease may be caused by a virus. Epilepsy is a seizure disorder of the brain. It's characterized by recurring and excessive discharge from neurons. The cause is uncertain. One portion of the brain stimulates another, setting off a cycle of activity that accelerates and runs its course until the neurons become fatigued. Cerebral palsy is a disturbance in involuntary muscular action due to brain damage. It is caused by abnormalities in the parts of the brain that cause movement. The most pronounced characteristic is spastic quadriplegia, which involves spastic paralysis of all four limbs. Poliomyelitis, also known as polio, is a contagious viral disease of the nerve pathways of the spinal cord that cause paralysis. This disease has been almost eliminated in the United States through the use of vaccines. However, the disease still occurs in other countries. Hydrocephalus is a condition that involves an increased volume of cerebrospinal fluid within the ventricles of the brain due to a blockage. Enlargement of the head can occur. Parkinson's disease is actually characterized by tremors, a shuffling gait, and the action of pill rolling, which is a movement of the thumb and index finger, and muscular rigidity. The patient with Parkinson's has difficulty initiating movement. The cause may be a decrease of the neurotransmitter dopamine. Essential tremor is a disorder that causes rhythmic shaking. It is a progressive, often inherited disorder that occurs in later adulthood. Multiple sclerosis is an autoimmune chronic inflammatory disease of the central nervous system in which the immune cells attack the myelin sheath of nerve cell axons. The myelin sheath are destroyed, leaving scar tissue on the nerve cells. This destruction delays or completely blocks the transmission of nerve impulses in the affected areas. The cause is unknown. West Nile virus. This is a mosquito-borne virus. Most people infected either have no symptoms or experience mild flu-like symptoms. In older adults, the virus may cause encephalitis or meningitis. Dementia. Dementia is a general term that includes specific disorders, such as Alzheimer's disease, vascular dementia, and others. Dementia is defined as a loss in at least two areas of the complex behavior, such as language, memory, visual, and spatial abilities, or judgment that significantly interferes with a person's daily life. Alzheimer's disease is a progressive degenerative disease in which the initial symptom is usually just a problem with remembering recently learned information. With Alzheimer's disease, the nerve endings in the cortex of the brain degenerate and block the signals that pass between the nerve cells. Finally, brain tumors. Brain tumors can develop in any area of the brain. Brain injuries can affect the central nervous system significantly. Here, we're discussing brain injuries of the hematoma, concussion, coup, and contra-coup injury. Hematoma is a localized mass of blood collection. Hematomas may occur in the spaces between the meninges. The cause may be a traumatic blow to the head. The person may have an epidural hematoma, which is located above the dura mater, or a subdural hematoma. In some cases, surgery may be indicated to remove the blood and reduce swelling. A concussion is the result of a severe blow to the head. It may be mild or severe, and there may be temporary loss of consciousness. The terms coup and contra-coup injury describe head injuries. Coup injuries occur within the skull, near the point of impact, such as when the skull hits the windshield in an automobile accident. Contra-Q injury, also described as a counterblow, is one that occurs beneath the skull, opposite to the area of impact. Brain injuries aren't just specific to the brain. These also can be affected in the spinal cord. The spinal cord may be injured at any level, but the mobility of the neck causes this area to be most vulnerable. The site of the injury, the type of trauma, and the degree of the injury all play a role in determining whether paralysis will occur and whether it will be temporary or permanent. This figure shows the most common types of injury. The areas that are affected correspond to the vertebra involved. C1 to C3 is the highest level of cervical spine. Injury there is usually fatal. Injuries at C1 to C4 may lead to quadriplegia, which is the loss of movement and feeling in the trunk and all four extremities with the accompanying loss of bowel, bladder, and sexual function. Injuries at C5 to C7 may lead to varying degrees of paralysis of the arms and shoulders. Injuries at T1 to T12 and L1 to L5 may lead to paraplegia, a loss of movement and feeling in the trunk and both legs. Loss of bladder, bowel, and sexual function are common. One most common effect to our brain is headaches. The three most common types of headaches are tension, migraine, and cluster headaches. A tension headache is usually a dull, squeezing pain that builds slowly and may involve the forehead, scalp, back of the neck, and both sides of the head. Researchers believe the cause is related to levels of the chemical serotonin and endorphins in the brain. Migraines usually start with a throbbing pain on one side of the head and gradually spreads. Migraines may be accompanied by nausea and vomiting. Lights, sounds, and odors may aggravate the migraine. In some people, a migraine is preceded by a visual distortion. Cluster headache pain is worse than migraine pain. This type of headache occurs more frequently in men. Cluster headaches can occur one or more times daily or for weeks, often at the same time each day, and then will disappear for months. I want to thank you for attending this lecture. If you have any further questions on this topic, please don't hesitate to reach out to your instructor.